If you've ever had surgery, you totally know that moment, right? That feeling of surrender when they tell you to count backwards from 10. But what really happens after your eyes close? Well, today, we're going to pull back the curtain and demystify anesthesia. Not just as some medical thing, but as a super precise guided journey from the moment you prep to your safe recovery.
Okay, so starting off with a pretty stark warning here from the American Society of Anesthesiologists. That sounds intimidating, doesn't it? But really, it's a good reminder of just how high the stakes are. The incredible story here isn't the danger, it's how modern medicine has totally risen to that challenge. With all the advances in monitoring and the drugs themselves and in training, anesthesia has become one of the safest parts of medicine. So yeah, the risks are real, but your medical team's ability to manage them, even more so.
Every successful journey, and I mean every journey, starts with a good plan. And for anesthesia, that plan gets laid out long before you ever see an operating room. This is the prep phase, and it's where your medical team really gets to know you to make sure your procedure is as safe and smooth as it can possibly be.
So who's your guide on this journey? Your anesthesiologist. I want you to think of them as your personal guardian through this whole experience. They aren't just the person giving you medicine to make you sleep, they are a critical care physician. They're planning your anesthetic, they're monitoring every single heartbeat, every breath, they're managing your body's entire system to make sure you stay safe, pain-free, and stable from the first cut to the last stitch.
This right here, this is where your safety plan truly begins. The pre-anesthesia assessment is this really comprehensive deep dive into your health. Your anesthesiologist is going to ask you about everything: your entire medical history, what meds you're on, and even how you've reacted to anesthesia in the past. This chat isn't just a formality, okay? It is literally the foundation of your personalized care.
So how does your team get a quick snapshot of your overall health? They use this, the ASA Physical Status Classification System. It's basically a standardized way to categorize a patient's health. You've got ASA 1, that's a totally healthy person. But as you move up the scale, say to ASA 3, you're looking at patients with pretty severe diseases. This score isn't just some label. It's a vital tool that tells the whole team how much support your body might need during the stress of surgery, and it helps them predict your risk level.
And that ASA score we just talked about, it's determined by factors just like these. Things like heart disease, diabetes, or even obstructive sleep apnea can really change how your body responds to anesthesia. And this is exactly why being completely open and honest about your health is so important. Your anesthesiologist uses this info to pick the safest meds for you and to plan ahead for any potential curveballs.
So, with your personalized plan all set, we get to the moment itself. What actually happens when you receive anesthesia? How does your body make that journey from being wide awake to being in a controlled state of unconsciousness? Let's break it down. First off, you gotta know that anesthesia isn't just one thing. It's a whole spectrum, and the type you get is indicated by what kind of procedure you're having. For a major operation, think open heart surgery, you're getting general anesthesia. For something like a C-section, a regional block, like an epidural, is really common. A colonoscopy? That's usually monitored sedation, sometimes called twilight sleep. And for just a simple skin biopsy, a quick local anesthetic is all you need.
Now, if we focus just on general anesthesia, clinicians have this framework to understand how deep the unconsciousness is. It's a classic model called Guidel's classification. Stage 1 is that initial sleepy, floaty feeling. Stage 2, the excitement stage, is this brief period that modern drugs help us pass through super quickly. The goal, the sweet spot, is to get you to stage 3 and keep you there. That's surgical anesthesia. Stage 4 is overdose, and that's the danger zone your anesthesiologist is meticulously trained to avoid.
Okay, so even when you're safely in stage 3, the work of the anesthesiologist is far from over. I mean, while your brain is completely unconscious, your body is still reacting to the physiological stress of the surgery, and managing that reaction, it's a constant, delicate balancing act. Your body is incredibly smart. When it senses tissue injury, which, let's be real, is what surgery is, it launches a defense. We call this the surgical stress response. It has two parts. The neuroendocrine system floods your body with stress hormones like cortisol and adrenaline, and your immune system triggers an inflammatory response, releasing these little molecules called cytokines. This is just your body trying to keep things stable and start the healing process. And this slide right here brilliantly illustrates the precision of modern medicine. It turns out different anesthetic agents can actually tweak that stress response in different ways. The inhaled gases, they're better at tamping down the stress hormones. IV agents like propofol, they have more powerful anti-inflammatory effects. So what your anesthesiologist often does is combine them. It's a technique called balanced anesthesia. They use lower doses of each drug to get the best of both worlds, all while minimizing side effects. It's just a perfect example of tailoring the anesthetic to exactly what your body needs.
So, after the last stitch is in place and the anesthetic is turned off, your journey continues. The next stage is waking up and moving to what's called the post-anesthesia care unit. This is where your team watches you like a hawk as your body transitions back to being awake, keeping an eye out for any side effects or post-operative complications.
30%. Take a look at that number. What do you think that represents? It's not a complication rate, actually. It's the leading cause of patient dissatisfaction after surgery.
That's right, post-operative nausea and vomiting, or PONV for short. It is incredibly common, but here's the good news. Your care team knows this. They expect it. They have really effective medications to both prevent and treat it. So while it's super unpleasant, it's almost always temporary and pretty easily managed.
Beyond feeling sick, you might also experience some of these other super common side effects. A sore throat is pretty standard if you had a breathing tube. Shivering is just your body's natural way of rewarming itself. And feeling groggy or foggy? Totally 100% normal. The key thing to remember is that these are expected, they're temporary, and they usually go away within about 24 hours.
Of course, we have to talk about the rare but more serious complications. But what's so crucial to understand is that the entire pre-anesthesia assessment is designed to screen for these very risks. When your anesthesiologist asks if anyone in your family ever had a bad reaction to anesthesia, they're screening for malignant hyperthermia. When they ask about sleep apnea, it's to protect your breathing. You see, it's all proactive preventative safety in action.
And that brings us to the final, and you could argue maybe the most important part of this whole journey, your role. Your anesthesiologist is your guardian during the procedure, but you are an active, absolutely essential partner in your own safety and recovery.
These 4 steps right here, this is your contribution to a safe outcome. Being totally honest about your history lets them plan properly. Following the fasting instructions is critical. I'm serious. This prevents a really dangerous complication called aspiration, where stuff from your stomach can get into your lungs. And avoiding smoking and alcohol just helps your body heal better. And finally, ask questions. Understanding the plan can lower your anxiety and makes you a much more confident partner in your own care.
So what's next? Well, the future is all about personalization. Scientists are actually exploring how our individual genes, our DNA, affect how we respond to anesthetic drugs. So imagine an anesthetic that's tailored not just to your health conditions, but to your specific genetic code. That is the future of the tailored sleep, and it's going to make one of medicine's greatest marvels even safer and more precise. Thanks for joining us.